Welcome to Habitual Excellence presented by Value Capture. This podcast and our company helps you and your team achieve habitual excellence and get better every day by focusing on one clear goal, one set of values, and one way of working. In simple terms, we want to help you create more value by providing the best care and the safest environment for both patients and staff. To learn more about Value Capture and our services, visit www.valuecapturellc.com.
Welcome, listeners and viewers. I'm Ken Siegel. I'm the Chief Relationship Officer at Value Capture, and really excited, as I always am, but I'm double pumped about this episode of Habitual Excellence. We have two of the crucial executive leaders from Lakeridge Health in Ontario here with us, Patrina McGrath and Tab Carroll, who have been pioneers in the whole lean movement across North America and humble learners, and who are now helping Lakeridge Health sort of take a 1.0 daily management system to 2.0 extra powerful status, and with tons of learning along the way. And we're really excited to talk about that. I'm also excited to welcome my colleague Didier Rabino, our Vice President of Operations here at Value Capture, who not only has acted as an advisor to Lakeridge Health for this stage in their journey, but is a key member of our team and a key member who we have here to talk about our excitement at expanding our investment in working with Canadian partners in the coming months and years. So Didier, welcome as well.
Hello.
Patrina and Tab, I'm going to start by asking you all to introduce yourselves. If you could briefly share your journeys to your current leadership positions, so the audience knows you a little bit, and then we'll ask Didier to do the same. Patrina?
Yeah, good morning. So my title at Lakeridge Health is the Health System Executive for People, Quality, and Practice, and the Chief Nurse Exec. So from that, you should get that I'm a nurse by background, and that was my initial introduction into healthcare. And through my career, I've probably spent a lot of time in the nursing side, but then in I was a director of nursing, and then I had the opportunity where I went to Saskatchewan, which is another province in the country where I'm from. And through that, we were going through a big quality transformation. And part of that, my role was this little portfolio called Quality that became part of my role as a chief nurse. And so that was really where I started to do a lot of learning. And had the opportunity to do a Kaizen fellowship and learn leaders across the whole province were going through learning around lean and quality improvement, process improvement. And so that really sparked my love of quality and patient safety and staff safety. And so that's really been part of my journey, going and seeing and learning from many organizations to where I am today at Lakeridge and our journey here.
Thanks, Patrina. And I'm sure listeners picked up all that you're responsible for, and also that you're someone who's a deep student of lean and also an operations executive, which I think is always an exciting combination. So speaking of which, Tab, will you introduce yourself, another clinical leader?
Great, thank you. I'm Tab Carroll. I'm the Health System Executive Clinical at Lakeridge Health, and I have quite a few of the areas that we're rolling out the 2.0 in right now. And so I have the emergency department, I have critical care, medicine, surgery, flow, women and children's program. And so there's a lot of operations involved in that piece. And I personally started off my career as an ICU nurse. So I'm a nurse by background and have been in leadership roles for, I hate to almost get to the point, close to decades now, in bringing in and helping these programs transform into stronger programs. I think from my lean experience, I'm definitely a Kool-Aid drinker on that, in the sense of, when people can see the change and see what the change is doing for them, that they're more apt to be involved in standard work. So really appreciate that. I do not consider myself an expert in lean. I think there's always opportunity to learn. I just value the process and trust the process is, I guess, what I would say. And again, very fortunate in my leadership role here at Lakeridge Health that there's a commitment across the entire senior leadership team. So quite often Katrina is my coach more than my colleague. And we work together on these processes. So it's very much a team approach. So I would say that even though these are my accountabilities, they're equally Katrina's as well as they are to other members of the team as well.
Thanks, Tab, and appreciate everything you had to say. And we're also joined by my colleague, Didier Rabino, our Vice President of Operations. Didier, will you introduce yourself?
Hi, thank you. I'm glad to be here. Well, my name is Didier Rabino. I'm Vice President of Operations. I've been working with multiple healthcare systems, and but I started leading operations more than 30 years ago as a plant manager, as an operation leader at Steelcase, and I started the development of operating system in the late 90s, early 2000s at Steelcase with David Mann, and in 2004 I started to develop the operating system of Andersen Windows before transitioning to healthcare in 2012, and I've helped several healthcare systems developing their operating system. So it's I love doing that. I like making stuff and developing systems, developing things to see better results. So that's a joy for me to not only develop systems, but develop the capability in people to lead these systems.
Thanks, Didier. And as your colleague, it's a joy to learn with you and from you continuously. Thanks for introducing yourself. All right. So Tab and Katrina, what would you describe as the need that you saw Lakeridge Health facing with your sort of existing approach to operational excellence, habitual excellence, as we call it, some call it lean, that caused you to say, we want to evolve further and maybe get some insight? What was the need?
Yeah, maybe I'll start. And can we refer at Lakeridge to excellence every day, and that's striving for excellence every day. So I would say over the last 3 years, we started out with really designing our quality daily management system, which included a tier huddle system. It included daily conversations, and really focusing on engagement, really gauging our people across the system in ideas and identifying opportunities and ideas they had that they saw every day to make improvements, and really talked about that. How do we help engage the ideas and thoughts of all of our team, what they're seeing, to make improvements. And then we started to look at what measures, how would we align that, and we were working hard to kind of take the strategic plan and align it to the daily work of our team members. Lots of great things, and continue to see great things from that system. I think what made me reach out or think about the 1.0 to 2.0 was there's a few things that we were observing. I think that we thought, well, we need some external eyes. And again, my experience has been going and seeing has been a great way, and inviting people from outside to come and see and share back with you what are some of the things that maybe you haven't thought about, or provide that external lens has always been helpful. And some of the things I was seeing, and I think Tab and I talked about, was people were seeing, we'd hear things like, well, we don't have time for this every day because we have daily operations. So those comments would be like, oh, so we see this as a quality huddle. We like it. We were hearing great feedback from staff about their ideas and then visually managing those ideas and seeing where they were at. But we were still hearing that kind of daily operations felt separate from our huddles every day. And in fact, we were hearing feedback as we went out. There's too many huddles. We have our tier 1 huddle, and then we have this quality huddle, and then we have this. And so the feedback was we're huddling too much. And we started to look at the way we were doing it. And in fact, we have opportunity to align that. I think the other thing Tab and I often talked about, and Tab might want to talk, is we tried to take our strategic priorities and make them fit at the point of care. And we were hearing like, well, that doesn't always connect to what we do every day. And so it felt a little forced and it wasn't necessarily resonating. And we were also not seeing a lot of movement. We were identifying the problems or seeing some Paretos and stuff happening, but we weren't really getting a lot of problem solving as it aligned to that work at the point of care. So, and I'll maybe hand over to Tab, because Tab's early discussions were, this isn't like fitting well, or there's something not right. So she can probably share a little bit more of some of the observations we were having.
Yeah, Tab.
Sorry about that. Yeah, I agree. I think the 1.0 was necessary to get to 2.0. In all honesty, if we look at the transition of continued growth, like we needed to get the teams coming together. We needed to get them talking. You know, needed to get them looking at data and those pieces. And so the 1.0 was good that way. It really though got that the team thought it was only related to things on the strategic plan, and so it didn't fit in like today we have a problem with X and how can we deal with that. It was more the bigger project piece. So and we were seeing a bit in 1.0 coming through in the team identified improvements. As opposed to being the whole part of the board really being about, how of the operational improvements for the day. So the nice thing when we moved it to the 2.0 model, it became more real for them. It was more their day, their work, their pieces that all fed into the ABP, the annual business plan and our initiatives, but it related to the frontline team. And one thing that we found is with the version that we had rolled out initially, people were identifying problems, but it wasn't carrying it through to the root cause analysis and the solution piece. Like there wasn't that closure of the loop. So that we found that in the 2.0 that, that the team really does walk through what is the problem, who owns the problem, where are they taking it, and then coming back and saying, is it resolved, isn't it, where is it at, and what's the project plan related to it. So I think we needed to go to 1.0 to get to 2.0.
Sure.
But certainly the 2.0 has really got us more to a root cause thinking and to actually empowering the teams to solve their problems. You know what I mean? Like as opposed to just always raising them and then having them drop again. So in my opinion, that was a big shift from where we went from our first piece to our second piece. It became more true to the team of what their work they were looking at, the problems they were focusing on, and they were still moving the organizational objectives forward.
Wow, that's great. So I'm hearing a need to go from a collection of good activities, but that we're seen sort of as on the side of sort of daily work, to connecting it to daily work, a deepening of problem solving, or a sort of rationalization of the team's time to what they really were responsible for and cared about, and sort of one flow. So that's awesome that you were able to sense that you had a need for change and then begin to put the pieces together. And it sounds exciting. And really actually solving those problems, right, that get in the way of the flow. Exciting. I'm sure everybody's wondering kind of how you've started to do that. What were the key moments that gave you the insight of what direction you needed to go? How did that work, that process for our Canadian friends?
Yeah, so I think, and maybe I'll just share, we started, I think, with Didier coming in. So one of the things was, I was struggling as well with how to get my team who are leading this work or designing it work to connect the dots between strategy, organizational development, and quality and patient safety. How do they all see their roles, or how does this all connect together? And so one of the things, when we invited Didier to come, I think, Ken, we talked to you and asked him to come and see, and he walked with us, and we invited our senior leaders and the director. We walked through surgery, which had been our model line. We had really started 1.0 first for a year. We worked with surgery and under Tabs, like co-leading And now we were spreading from surgery to other areas. And so we went back to surgery and we walked through a number of areas, talked to staff, and Didier asked incredible questions. And there was some, light bulbs for all of us that were going on. And then we had some discussion, and he provided some feedback on, our corporate scorecard, what he was seeing. And again, like always, those fresh eyes and some of the questions, and where there was connections and where there was things working and where there might be some opportunity. That really was helpful to us, because you know how that something isn't quite there, but you're not sure what the next step might be, and having somebody help you think that through was really helpful. So and the other thing I'll just add is, and Tab might add to this as well, is I also found that my team was the one that was checking on, are the huddles happening? Is it sustaining? Is it not sustaining? And they were, trying to get to all of these huddles and that. And what I was thinking is, it wasn't really owned at the senior level of the organization. We actually, if we asked each other, how are the huddles going? We actually didn't know if they were actually happening or not, unless we happened to. Sometimes we went and we arrived and it didn't, because we were rounding. And so there were some things, but we didn't have that kind of connection to know at any one time. And again, that required, why weren't they sustaining? That really required us to ask some questions. Why weren't they sustaining, and what do we need to think about? So kind of that combination of that ownership. Do we understand it? What's our role at the senior level to own that system versus every level down?
Wow. Huge learnings rolling off your tongue, Patrina, for everyone. And that shift to senior leader ownership from subject matter expert is fundamental. So absolutely. Tab, I'm going to ask you two questions. You can answer one or both or neither. The first is, any aha moments that you've had along the way as a leader about this. And the second is, when I've heard you talk about this, you really observe sort of a pretty powerful coaching cascade that you've built into your 2.0 system. I'd love to hear you talk some about that coaching in the course of work aspect of your 2.0 system.
Yeah, I agree. Like Katrina was just making the comments about the coaching. My experience was with the senior team actually being part of the education. So when I was actually sat through as much as I could the education that the directors and the frontline team were going through with the 2.0 version, I was actually seeing leadership competencies while I'm sitting there and looking at how they were looking at problem solving. I was getting a better understanding of knowing my people. So like knowing what their problem solving root problem analysis skill sets were, how they took on challenges, how they even pictured, the operational versus strategic initiatives. So it was just actually being in the room was a lot of learning for me about where my team was. And as we were going through it with the education and those pieces and understanding the board and really understanding the different phases of our board and the problem solving from start to finish, where my team was in being able to move things from one side of the board to the other. It was quite interesting. But what I found even more interesting was we had coaching questions. So there was questions for the director to ask the manager. They both had the questions. They both understood what they were. And there was questions for me to ask my director. And it felt very unnatural at first to ask a question that's on a card and make that happen. But what I saw was with the repetitive asking of the same questions, there was growth because the manager knew what was going to be asked for them. So they had the answer for the question before it got there, and it actually became part of their standard, practice or standard work of competency. So in the end, I saw some of the gaps that I had seen in the actual initial education closing as we worked through the coaching sessions and those pieces. So I would say, for people who are looking at this, don't trust the process. Right? So trust the process. It may not feel natural at first, but trust the process and you'll see growth in the team.
It's amazing the questions start to work on everybody, right? And then you're right, that absolutely guides their growth and their connected growth, right? And then you as a senior leader are able to observe the people's development. And then leveraging daily work to help that happen as opposed to having to stuff it in there. So
Yeah, no,
wow,
and honestly, in
fantastic.
some situations, I looked at some leaders and thought they're not getting this. Like this is a big gap. Like this might be an insurmountable gap, and it wasn't actually
Mhm.
when the questions started to come and they started to coach, and then the person was moving along. They actually strengthened considerably. So someone who I was actually wondering whether this was even possible to move did move.
Thanks so much, Tab. And Patrina, you sort of got us kicked into that by talking about senior leadership roles changed, right? And connection change. Anything more you want to say about that? Because, Tab, you've talked about all of the layers down to the floor, and Patrina, you've talked about senior leaders taking more direct responsibility and connecting to that. So, do you, anything else you want to say about that?
Yeah, like I think you can underestimate the coaching opportunities, and building coaching into daily as opposed to I think in my career often we talk about coaching and we're sitting in an office and we're talking about where you want to be and where are you
Mhm.
now and how are you going to get there, and we're having this conversation, but it's a different type of coaching when you go and see and observe in the moment, right? And um part of what I've really seen, and it's interesting because often I was with Tab as we were in the OR or other areas coaching. Now my own teams are going through 2.0. And so I can really see it as another way as well around how I understand, as Tab was saying, how I understand where my director's at, how I understand where each manager, and again, this goes back to that principle of respect for people for me. It's like every manager is in their role or supervisor, but they've had a different background, they've had a different journey to get there. And so when I think about the coaching, I now kind of have a ability to see where my director's at in their coaching, but they all have a plan. They have a plan for every one of their managers, right? Because they've been able to see where they're at, what the challenges that they've given them. We're using, a challenge as growth opportunity. So, you're here. My challenge to you is here, and you're coaching and working through, and it really helps you see. I think it's again, can you see the thinking? Can you see how it shows
Mm.
up in the day-to-day conversations? And it really takes that from a once a month conversation or once a quarter. You talk about performance reviews and all of those things too. Really, every day we're having conversation around that can really help. Ask good questions, and they always say that the questions you ask are fateful. So if you can be curious and ask those questions, it really creates this momentum of constant learning and ahas that I see happening. And you can see the systems that aren't working. Like I think Tav and we
Mm.
probably like after a while, you can actually see, oh my gosh, these systems that we have designed are the obstacles to our delivering what they need to deliver on today. And you start to see those trends across and recognize, okay, now this is at our level that we need to shift and change as well.
So as you've simplified and connected the systems more to the flow of actual work, caring for patients and the people's jobs to do that, where they want to be successful, and you've linked this coaching engine, development engine, have you seen the team start to take these ideas inside and apply them themselves?
Yeah, so it's a funny story, but one of our physicians who are involved in the huddle says he's no longer sends as many nasty emails as he used to send, because there's actually an opportunity for things to be discussed and problem solved at the board. But it's gone farther than that, because in the sense that they are owning like the opportunity of problem solving themselves. So it's not like it has to go. Certain things do need to go up the tiered huddles, but some things can be managed right there at the front line, and they can address them themselves. And to be honest, you've always heard that from one of the house fell down. And sometimes in programs, it's some of the smaller issues that have been there for years that they just feel can't be addressed that finally get fixed. And an example that I give in one of my programs was we have certain equipment that needs to be there every day to be able to manage the patient. And we were always having a lack of knowing whether we had enough, equipment in the areas. And so it was certain, meeting with the stores team and actually putting in processes in place that they were notified if there was a shortage, so there was time to find what they needed. And honestly, this had been going on for years of all of a sudden this last minute crisis that we didn't have the soda lime to do the case and those kind of things. That actually was a fairly simple, solution when they actually got to the table and followed it through, which the board coached them. You identify the problem, who are the, the people that you're gonna meet with, and what's the process that you're gonna use to do that, and where is it at? And now are we tracking it to make sure that we're still doing it? And so I actually think those are the wins that actually get the true buy-in from the frontline team is fixing those safety issues they have every day that don't necessarily get triaged to a patient risk thing, but it's a challenge every day that they're overcoming that actually puts it right up there in front of them. And so now this is their process, right, of getting things fixed. And the physician who had said he stopped sending all these emails says he can walk by the board now and know the answer to his question. That he doesn't have to send the email because he can look and see what's been done and he knows where it's at and those pieces. So it has kind of changed the culture of of how we communicate and how we resolve our problems.
Wow, that Didier and I think hear the flywheel of habitual excellence really getting going, building on really good work already. So fantastic, guys. That's a great example. It's not all peaches, roses, and champagne though, right? It's a lot of work ahead and lots of challenges. So you guys are both always very humble. Do you wanna talk about some of those challenges and that you're working to overcome now?
Yeah, I think a couple things. So one, we're still in a bit of a hybrid world, right? We're still bringing up. So we again took kind of a model line approach with 2.0. We kind of learned that. Then we've gone to a few other areas. We've been focusing a lot on the non-clinical areas because they hadn't gone up in 1.0, and so they were still like without anything.
Yeah.
So we're still in I would say it's messy because we're in kind of a two worlds, and our next piece will be what's the right tipping point now for us to just do a all conversion, if you will. And I would still even say when we think about all the aspects of our daily management, where it's like, looking at yesterday, planning to win today, and designing for tomorrow. I would say even the teams that are live with 2.0 are still getting comfortable with all the sections. So,
Sure.
you can only take on so many things. So I would say we've been really focusing on the mission, like why do we exist, safety, the reflection on yesterday, plan for today. I think the planning for tomorrow is still work that we need to do. And every team is a little bit stronger or have picked up on things differently. So again, that's why the consistent coaching, understanding, even as we go through, we're realizing, I don't think people are really understanding. We need to go back and look at how we're teaching it. Maybe we need to step back again and see whether the way we're explaining it or doing this part, maybe we need to do some booster discussions, education, and look at that. And then we've got other systems that, like we have a WeCare system where safety, and so we've got to simplify so our teams aren't duplicating work.
Right.
So we now have to look at some of our other systems. We're also about to launch a new strategic plan. We're just in the design part. So we're kind of seeing that once we get that new strategic plan, it's another opportunity for us to really design that catchball at a deeper level and do some more of that connection. We've had catchball to inform the strategic plan. Now, as we go out, I think the choosing the metrics, the coaching on metrics, all of those things are still opportunities for us to grow. And then the coaching, like healthcare, it's busy, right? And you never know when something's going to come out of the blue that from in Canada, it's the Ministry of Health or other organizations that you didn't expect or anticipate. So we're still learning as a senior team when we have a weekly reflection around what was our plan at the beginning of the week to do coaching, to observe huddles, and what did we learn. And some days we had a target of getting to 3 huddles and we only got to 1, and what got in the way. So we're still also learning around what are some of the obstacles in our system at Lakeridge that we've got to understand and pay attention to, and in order for this not to again drift or to not sustain. So lots of moving pieces, it feels like right now, Ken, and so still learning every day, but there's lots of positive things we're seeing from it, and excited about kind of continuing on.
Fantastic. Tab, before I shift us a little bit, Tab, anything you want to add to challenges and issues of momentum and things like that? Yeah.
So actually, one of the things, if Didier wonders if I listen at all, but one of the things that he did present is about why can't we do this? Is this an act of God that we can't do this? And so I'm sure my team wishes that I never heard that before, because I keep asking, so tell me, what is the act of God that says we can't do these things, right? And so one of the barriers that or obstacles I would say that we have is we're a multi-sited organization, and so we sometimes have leaders that are at 2, 3, 5 different sites, depending on where you are in the organization, and getting there and being at the huddles and being able to do those things. But then again, we have to go back and look at what are the acts of God that are preventing us from doing that. So, I just, instead of just putting that as a barrier and saying that's, we can't do things, we have to find a way around it. And so I do think that most of the leaders have found ways. Some have tried virtual opportunities, and we're looking at different angles of being present, even if we can't be physically present. And the coaching, we've done some modifications to be able, if we can't be at the board with the person at the time, then maybe we can just be with the person and at a different time, and walk through the board together. So, there's been, like there are things in everyday life that make some things challenging, but then doesn't mean we can walk away from it. We have to find another way to meet it. And so I think, from an operational perspective, that is how do we make sure that the coaching is happening and that the people can't come up with excuses and obstacles that it doesn't happen, that we actually put things in place to find a way to make it happen, because I don't see an act of God that stops us from doing that. So I can't come to Didier and say it's not possible. Anyways, so I would say that would be the number one that Petrina had said that I would say is if you're a multi-site organization, you have to be many places many times, but this is priority work and you need to figure out how to make it happen, and there are ways. So again, if you follow the board, you can find your root cause of problem solving and come up with a process solution that you can track. So trust the board, follow the process.
Fantastic. And to hear you guys showing leadership with humility as a principle, and then using the process to, to solve those problems, and those powerful aspirational ideas like, if God didn't prevent it, we can do it, sort of thing, is fantastic music to our ears. So we want to shift in our last few minutes, because you guys, I'm sure you'll have listeners rising out of their chairs with sort of the authenticity and sort of organic beauty, really, of the work that you've done so far. And beyond that, you guys are creating a learning opportunity for your peers, certainly across Ontario, but I'm sure others could come as well, to come learn from your 1.0 to 2.0 journey and come see on October 15th. So can you guys describe sort of what you're creating? And Didier, feel free to jump in. It's a multi-part learning experience, all concentrated in a single day. And I know for free. So who'd like to talk about the event?
I can maybe start, and then Didier, happy to hand over to you and Tab or event. So what we've set up, and again, I think learning happens 2 ways always, right? We learn from going and seeing and seeing how others are doing it, but also when people come and see, they share reflections back and either reinforce what they're seeing or give you other ideas as well. So we see this as a real win-win opportunity. So the first is really we'll talk about a little bit about our journey to date. Didier is going to be doing some core, that core education. And I learned so much from Didier when he came here. And so it's really about those principles. Systems drive behavior. So how to understand, how to observe your systems. And so really looking forward to his expertise and content. And then we're going to go and see, and we're going to talk to leaders and teams who have been on this journey over the last little while, and see them in action. We'll get a chance for you to hear kind of their learnings and some of the challenges and opportunities. So hoping that also creates a bit of learning community in Canada and learning community in our networks that we can continue. And I know this week already we're going to our colleagues at Hamilton Health Sciences to go and see, and they're coming back. So even before we've identified some people that are on a similar journey, and we're really excited to kind of share and learn together.
Fantastic, Patrina. Tab, would you add anything?
No, I'm just looking forward to the day, because every time somebody comes, we hear something that they're doing and we learn something new from them as well. So excited to see people coming for the 15th of October, and having more education and reinforcing what we already know never hurts us at all either.
Terrific. Didier, let me bring you into this. So anything else you want to say about the October 15th event? And then I'm going to broaden my questions to you.
Well, I'm really excited that Lakeridge Health is hosting this event, and I will be just helping them to coordinate. But there's a lot of learning that happened in a relatively short period of time, from over the past 6-9 months, and there's a lot to learn. A lot. Yes, it's a journey, and Petrina says. We are not. It's not about the destination, but there's a lot of learning during the journey, and learning can only happen when we are humble, when we are allowing ourselves to try new things, and you are going to see a lot of things that have been tested, tried, learned. We say what FAIL is an acronym for first attempt in learning. There's a lot of first attempt in learning, and I invite people to see them. So that's going to be an opportunity for many healthcare organizations. Hopefully, around Ontario, there's a lot of people, a lot of healthcare systems in Ontario. We talked about HHS. There are many other ones, and I hope that we can bring the community together to explore how we can help other healthcare systems to improve the care for their patients, and also the care for the care providers, so that they have a higher sense of purpose, and they can see, how can I learn from what happened? What can I plan to win today? And what am I going to challenge in order to make tomorrow better? So that's the first, I will say, the first learning day that we'll have at Lakeridge Health. I hope that we'll have many other learning days in other healthcare systems, and that we can spread the learning across the 13 provinces and territories.
Didier, let me ask you a follow-up in our last minute together here before I thank our guests. This learning journey and these superstars, no one will be surprised that how deeply we value our partnerships with Canadian healthcare leaders who think and act like these do. And so I know we're expanding our investment and our desire and our effort to create more of these partnerships. Why now? Why Value Capture Canada now? What else do you want leaders to know about our desire to support leaders who want those outside eyes?
Yeah, and so for more than 20 years, Value Capture has mainly operated in the US, supporting healthcare systems in the United States. We've supported healthcare systems in Canada. I supported several of them, and I think we decided to have a larger presence and be more present. And I think it's a part of respecting every individual, every country, starting with our neighbors. This is why we created the Value Capture ULC, that is really focused on supporting healthcare systems in the 13 provinces and territories. So there's an opportunity. It's not a cookie cutter approach. When you cannot find two healthcare systems that have exactly the same competencies, the same culture, and so on. And that will be the same. The healthcare system in Canada have different constraints. They operate with fixed budget. Even among the 13 provinces and territories, you have very large differences. So it's our adaptability, I think, is a positive aspect in our support, and I'm really excited to being able to support our neighbors in Canada.
Thank you,
And
Didier.
I can do that, and we can do that in French, or we can do that in English.
Right? We have multilingual approach. We're getting a note from Tab that she's lost her audio, so we're sorry, Tab, and we know you have to go. Let me also just ask finally, if people do want to find out more about the October 15th event, what's the best way to do that? I know they'll be able to find it on our website. And Lakeridge, I assume you'll be getting some word out in healthcare networks. Okay, terrific.
Sharing it out with networks.
Okay. And at this point, I know Tab has to go run a leadership huddle, and Patrina, you too as well. So everybody will be very excited to listen to this and hear your journey and want to learn more from you. And we just can't thank you enough for joining us. Tab, thank you. Thank you for coming. Patrina, thank you.
Thank you.
Thank you for being our guest today.
Look forward to the 18th or the 15th.
Great. Terrific.
Thanks for listening to Habitual Excellence by Value Capture. We hope you'll subscribe to the podcast. Please also rate and review it in your favorite podcast app. To learn more about Value Capture and how we can help your organization on a journey to habitual excellence, visit our website at www.valuecapturellc.com.